Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks, what is a nervous breakdown? So this is generally considered a colloquial term used in the general population, but the term nervous breakdown isn't really used by the mental health treatment community. For example, it's not an official mental disorder referred to anywhere in the Diagnostic and Statistical Manual, and it's also not found in the research literature really hardly ever. It's not a construct that we study. So mental health clinicians don't use the term nervous breakdown to refer to really anything. It's not something we use. Now, what makes the term nervous breakdown really interesting, though, is that it's so popular with the general public, and again, so unpopular with mental health professionals. This is actually really quite unusual among mental health related terminology. So we see many technical mental health terms that have made their way into popular usage, even if they are used differently by the general public than they were originally conceptualized by the mental health professionals. For example, sometimes we see depression is used when really sadness is what people are talking about. Depression means something very specific in the mental health treatment community. Or we see the term antisocial is used to mean avoidant. Or sometimes we see the terms schizophrenia or bipolar disorder to mean that somebody has multiple personalities, when of course none of those usages is technically correct in terms of how we use them as mental health professionals. So most mental health clinicians hear the term nervous breakdown and they think of a general level of mental health distress, but they do not assign it any specific diagnostic meaning. So for instance, they wouldn't use it to help figure out what diagnosis somebody may have. Essentially, it's thought of as an amorphous term for general emotional disturbance that has no scientific value. It's a non-specific descriptor. So then the question becomes, is this actually true? Or does the term nervous breakdown actually connect to a mental health construct? Meaning, when people use the term, are they using it to represent a unitary construct? Does it actually mean something, at least somewhat specific, and is the intended meaning relatively consistent? So I looked for this term nervous breakdown in the research literature, and of course, as I mentioned, you won't find it referred to very often at all. But I did find one article published quite a while ago, back in 1998, that examined this very question. Does the term nervous breakdown actually mean something? Is it actually an important term? And not something that clinicians should just really discard and not worry about. And even though it is an older paper, it's actually a pretty good paper, and it explained the concept and studied it, I think, in a really interesting way. And I'll put the reference to that article in the description for this video. Now, what we do see in the research literature does allow us some sense of what a nervous breakdown is before we get to this paper I'm talking about here. And it gives us some information about how we could define it, but again, not exactly. So for example, we see that the term nervous breakdown is generally considered to be less severe than another vague term, insanity. It's also considered to be reactive in nature, so somebody wouldn't have a nervous breakdown because of their genetic makeup, but rather because something stressful just happened to them. We also see that many people consider it not to be chronic, rather it's time limited, it's constrained to a time range that's closed in and narrow and not expansive, and it's not tied to personality variables. So it's not an expression of a personality disorder, for instance. So that's what we knew before this article. So now moving up to this particular study, what did they find in this study? Well, they found that most people tend to use nervous breakdown to refer to a time-limited disorder. So that was consistent with what we saw with prior research. And this disorder is conceptualized mostly as having depressed and anxious features. They also found that people tend to think of it as having reactive etiology. So what that means is that somebody's reacting to a stressor. So etiology means what causes a disorder. And interestingly, the reactive etiology wasn't to any type of stressor, but really specifically connected to external stressors. So not something internal, but something outside the person. So what about what's uncharacteristic of a nervous breakdown? So what symptoms are not associated with it? Well, it doesn't seem to be tied to mania, so that would be an elevated mood with like a lot of energy, like what we see with bipolar disorder, not associated with paranoia. Sometimes we see paranoia with schizophrenia, sometimes with major mood disorders. We see it with paranoid personality disorder. It's not associated with paranoia. It's not associated with psychosis, so hallucinations, delusions, having a break from reality. It's not associated with somatic complaints. That's when somebody experiences physical symptoms, but there's no medical explanation for those symptoms. So it's something that's related to mental health that kind of churns into physical pain. And it's not related to phobias. So phobias would be where somebody's afraid of something. And there are many specific phobias out there. So with all that in mind, were they able to tie it to a specific diagnostic classification in the DSM? And the answer to this is yes. It actually is fairly close to a mental disorder named adjustment disorder. And even more specifically, adjustment disorder with mixed anxiety and depressed mood, which interestingly is one of the most commonly diagnosed mental disorders. The outpatient prevalence of adjustment disorder is somewhere between 5 and 20%, and the inpatient prevalence is near 50%. And if you think about it, this actually makes a lot of sense. Adjustment disorder involves the development of emotional or behavioral symptoms in response to a stressor that can be identified. It has distress that's out of proportion with the severity and intensity of the stressor, which really kind of implies that a person is perceiving the stressor in a way that's distorted. And I'll talk about this more in a moment. We see that adjustment disorder is characterized by significant impairment in social occupation or other areas of functioning, and of course a nervous breakdown would be as well. And it's not an exacerbation of a current mental disorder. So adjustment disorder, just like nervous breakdown, is not tied to a prior mental disorder. It's not when somebody already has a mental disorder and those symptoms become worse. For example, with major depressive disorder, somebody has episodes of depression, and in between those episodes they usually feel quite a bit better. That's not what we're talking about with adjustment disorder, and not what we're talking about with the term nervous breakdown. So the findings from this study are certainly interesting, but how do I think about the term nervous breakdown from my clinical experience? Well, I think I do largely agree with the findings of the study, but I would add a few things to this. I've seen this term used a lot to refer to someone who's simply overwhelmed and they have no way to cope. So it's when somebody's experiencing too much stress. They're experiencing too many stimuli, too much information, too many problems. They can't retreat anywhere, so they simply stop functioning. They experience a lot of depression and anxiety. So sometimes people simply cannot compensate for all the stress. So I really think that a nervous breakdown can happen when people are under too much pressure. So to use an example, really not even from my clinical experience, but just an analogy to something I have done in real life. So last weekend I bought this old Toyota Highlander. I like buying old Toyotas and fixing them up. And when I bought it, I knew that it needed a timing belt and all the other things that come with when you change a timing belt, right? The water pump, the idler pulleys, the cam seals, the crank seal, all those things. So for me, because I'm not really that good a mechanic, it takes me around 10 to 12 hours to do a timing belt. And of course a job like this involves a lot of different steps. I could stop whenever I wanted, I could take breaks. I didn't need to finish this timing belt replacement in a particular amount of time. But imagine if things were different. Imagine if I needed to finish the job in order to have a vehicle ready to drive to work. Or if I kept focusing on all the steps at one time instead of just the step in front of me, right? So when you go to replace a timing belt, you have to take off a lot of other components as you work closer to the engine to get that timing belt off. And then of course when you put the new timing belt on, you have to work back and put all the pieces back on. So if you start to think about all these things at once, it can become overwhelming. You start to think way ahead. We call this borrowing worry, right? You start to think about the entire job, and that in itself becomes overwhelming. So if a job like that has to be finished by a certain time, or you think about the whole job at the same time, that's a lot more pressure. The job is actually the same, the steps are all the same, but the stakes are higher or the perception is different. Now, of course, this is just an analogy. Most mechanical work won't lead to a nervous breakdown or anything like that. But it's a good analogy, I think, in terms of how we conceptualize people getting overwhelmed in situations. So for people having a nervous breakdown, we have to do more than just look at what the stressor really is. We also have to look at how much pressure the person is under, or how much pressure they believe that they're under. Sometimes people just need an opportunity to escape the immediate pressure or to look at the stressor in a different way, like looking at one step at a time in that job instead of contemplating the whole job at once. Sometimes it's helpful to focus on what needs to be done right now in order to cope with the stressor, rather than trying to solve the entire problem with one theory or one strategy or solving it at one time. So considering all these factors, what's the moral to the story? Well, even if the term nervous breakdown isn't used in research or in clinical practice, that doesn't mean that the term is not useful. It doesn't mean that the term doesn't mean anything. Many people recognize when adjustment disorder is manifesting, but they may not know the technical term used by mental health clinicians. So the term nervous breakdown has really come to mean about the same thing as adjustment disorder. I can certainly understand how clinicians are sometimes unnerved by the use of non-specific terms and the misuses of official terms. I think this happens in every profession. Professionals like to use technical terms in the way that they are supposed to be used in that profession. But that doesn't mean we can't learn something from these terms. It doesn't mean that we should just ignore these terms altogether. So I talked before about depression and antisocial, those terms. If somebody uses the term depression to mean sadness, well, sadness is still quite painful. That still means something. If somebody uses antisocial, but they really mean avoidant, well, there's actually a personality disorder named avoidant personality disorder, which causes a lot of suffering. So avoidance can be problematic. When we hear the term nervous breakdown, we need to pay attention. It may not mean anything officially to mental health clinicians, but it may mean a lot to clients. Now, I know whenever I talk about terms like nervous breakdown and all the different meanings these type of terms can have, there'll be a variety of opinions, people who agree with me and disagree with me and have other thoughts. Please put those opinions in the comment section. They always generate a really interesting dialogue. As always, I hope you found this description of the term nervous breakdown to be interesting. Thanks for watching.